Your call cannot be completed as dialed.
Last name Kim, K-I-M as in Mary.
Nine, 23 days under 1%. So the state is doing extraordinarily well. And again, kudos to all New Yorkers, because there's no mystery as to how this happens. It's a social action. We talk about social action. This is social action. This is the community of the people of the state of New York acting out of mutuality and concern for one another. Community action. Worked at it all my life. I've never seen it on this scale before, and it's all good. Western New York, for those of you who are interested, we've been watching Western New York. It has been, we have a caution flag up on Western New York. The infection rate yesterday was 1.6%. That's still the highest in the state. Every other region was below 1%. We've started a focused testing effort with rapid turnaround. We set up 8 sites. We did 1,000 people. Those numbers for one day show about a 3.4% infection rate for one day. That is a very high number, but that is not a random number. These are people who decided to come in to be tested. Normally you get a high infection rate under those circumstances because these are people who think they may be infected, right? That tends to be the driving motivation for people who show up. So 3.4 is high, but again, it's not random. What is interesting is you do see different geographic variations. The city of Buffalo was at 5.5. County of Erie, 1.5. County of Niagara, 2.9. Chautauqua, 1.5. So we're going to use that information and continue testing and start to focus on those geographic areas that are showing higher numbers. In general, we have not hit what people talked about as the second wave. The second wave discussion was on the theory that the virus would mutate and come back. And that was going to be the second wave. Parallel was to the 1918 flu pandemic. We're still in the first wave. But what we're seeing across the world and across the nation is difficulty in the first wave. It's a rebounding of the first wave, right? In a wave tank. It's that one wave going back and forth. and we're still struggling with that first wave. And it's troubling. You look at places in Europe, you have France, you have Spain, you have Germany that are seeing numbers tick up. Parts in this country where you're seeing numbers tick up. So we have to be careful. Our New York is very much the exception to what's going on around the world with COVID. And I'm very pleased with the progress all New Yorkers should be, but we have to protect that progress. And what you see, again, going on around the country and around the world should keep us on high alert. We're especially seeing the challenges that will come in the fall when people start to go back to school. Colleges are opening. Colleges open sooner than K-12 and high schools. And colleges are having issues. There are already 25 colleges across the country that have significant issues, over 250 cases. The 25 colleges are all around the country. It's Florida, it's Texas, it's Alabama, it's North Carolina. It's also Michigan. It's also the state of Washington. So colleges, to me, are very much a canary in the coal mine. And colleges are just showing what happens when you bring back a concentration of people, even with all the precautions, even with everything we know, because you still run into human behavior. I've spoken to a number of college presidents, private college presidents, and I've said to them, look, I get it. You go back to college. You want to see your friends. Part of the college experience is socializing. I know many of the people who are on this phone call, when they were in college, they socialized. I know many of them went to parties. Many of them consumed alcohol, did all of those things. I studied when I was in college, but I know not everyone was in the library when I was there. I understand, but and I understand the colleges want to be have a good relationship with the student body. But if the students act irresponsibly or the precautions are not in place, then the virus will spread, and then more dramatic action is going to have to be taken and needs to be taken. And if there is an outbreak on a college, it's the concern for the college, but it's also a concern for that community, local community, and for the state. We have a new chancellor of the State University System of New York. He happens to be on the phone with us, Jim Malatras. SUNY, I think, is lucky because Jim has been intimately involved in the entire COVID management system from day one, so he gets it very clearly. And he's been brought that orientation to SUNY. He is taking action today at Oneonta that I think is right. We have him on the phone, and I'd like him to speak about the situation at Oneonta and the actions he's taking today. Chancellor Malatras.
Thank you, Governor. Thank you, everyone. We had reports of several large parties of our students in Oneonta last week. And unfortunately, because of those larger gatherings, there were several students who were symptomatic for COVID. And upon testing, we found that 20 were positive for the COVID virus. As a result, we deployed the SUNY Upstate Medical University team down to SUNY Oneonta, one of our premier medical research facilities, to test all students, nearly 3,000 or so at Oneonta, which began on Friday. And right now, as of this morning, we have around 71 confirmed positive cases, up from 20. And because of our other testing, we're confirming another 34 tests. So we're about 105 positive tests at SUNY Oneonta, which is about 3% of the total student and faculty population that are on campus at SUNY Oneonta this year. As a result of the increase of tests, and positive tests for COVID, we are going to be closing the SUNY Oneonta campus for 2 weeks for instruction, and we will assess the situation working with the state and local health departments after 2 weeks. I want to thank the Governor and Commissioner Zucker. They've deployed case investigators and contact tracers to help with the situation, and the state is deploying a SWAT team to come into the Oneonta community to set up 3 rapid results testing facilities so that any resident of the Oneonta community can be tested. It's a 15-minute test. The hotline will be, and the locations will be released on Monday, and we will start testing on Wednesday because many of the students, of course, live off campus. There's a lot of interaction in the community. There's a private college nearby, so we want to manage any potential spread and address it immediately. But we're taking this action because we think it's necessary in order to show folks that this can spread quickly and we have to address it quickly. And the other piece that we wanted to mention, because the governor mentioned it, we understand students are coming back, we understand people want to party, but individual responsibility plays into the collective good. So your individual actions have enormous consequences on everyone else in your college community. 5 students in Oneonta have been suspended for holding parties against the college policy. 3 organizations, campus organizations, have been suspended. And that goes along. We're going to be tough on those students, not because we want to ruin their fun, but this is a different time. And this goes to what other campuses have been doing. We had to suspend 43 students at SUNY Plattsburgh for similar things because we have to address this during the new normal. So we will be doing that today, and we're going to meet with the local community leaders and the school to go discuss that at 1 p.m. today. So thank you, Governor.
Thank you very much, Jim. And just to echo what Mr. Malatras discussed, and this should be a message to the private colleges also. I understand college life. Jim said students like to party. I never used the expression party. I said socialize, which I thought was a more appropriate term to use in the academic setting. But we understand that. And I understand the tension between the school administration and the student population. But the lesson is always the same. If you are not prepared, if you don't have the right precautions, or if you don't enforce the precautions, then the virus spreads. And then you have to take more dramatic action, which is more disruptive and generates more energy, a more negative energy. So private colleges, I think if you are slow to enforce the rules, then the virus will spread, and then you will have to take more dramatic action. If a private college doesn't take the dramatic action, the local health department can make the college take close down procedures. If the local community doesn't do it, the state can do it. 3% infection rate, that's a high infection rate in a congregate situation. 3% is high in a dense environment, like a dense urban environment, where you have people taking public transportation. It's a crowded environment. 3% is high. So I think the chancellor's doing the exact right thing at Oneonta, and I think he's taking the right actions across SUNY. And I think the private colleges should really follow the example. As I said before, I think the colleges are the canary in the coal mine. I think what we're seeing at colleges, we're going to see in the K-12 setting. When those schools start to reopen, I know there's a lot of conversation in districts across the state. I speak to many school administrators, many parents about this. They have to have the right plan in place. Look at the colleges. Look at what's going on. Have the right plan. And be in a position to actually implement the plan. Some school districts were having conversations about testing and what they'll do in terms of testing. It's one thing to have a plan that says you're going to do X number of tests. It's another thing to actually have the capacity to do that number of tests. So it's not just the plan, it's the implementation of the plan, right? And bureaucracies are not the best change-oriented systems. And this is a major change for a bureaucracy. And this is a task that has to be completed quickly. So it's an entirely new system, an entirely new task that has to be completed very quickly. So a plan on paper is one thing. Being able to do it is a second question that has to be asked. And my advice to the K-12 is the same. Err on the side of caution. Err on the side of caution. If you go to in-person education and you are not prepared, or you can't actually implement the plan and do it on day one, you will see the numbers go up, and then you'll see more disruption. So err on the side of caution, smart plan, a plan that you can implement, and if you're not ready, better you start when you are ready. You know, everybody's anxious to get back to school. I get it. But everybody should be anxious to get back to a safe school, right? We're opening safe schools this year. That's what we're doing. Not just schools. We're opening safe schools. With that, Dr. Zucker has an announcement, and then we'll take questions. Dr. Zucker.
Sure. Thank you, Governor. With flu season around the corner, the Department of Health will put out regulations tomorrow saying that all deaths involving respiratory illnesses need to be tested for COVID-19 and for the flu. This will maintain the integrity of our data. It will remove any reporting of presumed cases. This is very important information to have. I want to add that I urge everyone to get their flu shot unless there's a medical reason not to do so. Every year I urge people to get their flu shot, and this year is no different, especially with COVID-19 virus that's circulating in the community. So we will have those regulations out tomorrow. Thank you, Governor.
Thank you, Doctor. I'm ready for my flu shot whenever you're ready.
Okay.
I am ready. I will take it
I got it.
without grimacing. Like I did that test on the nasal, 6-foot nasal swab. Any questions, guys? Operator, if you can open it for questions, please.
As a reminder, to ask a question, you will need to press star 1 on your telephone. To withdraw your question, please press the pound key. Please stand by while we compile the Q&A roster. Our first question comes from Nick Reisman of Spectrum News. Your line is open.
Hey, good morning, Governor. I was wondering if you could react to the New York State United Teachers Union the other day urging statewide guidelines for mask wearing at all schools in New York. They want some exceptions, obviously, for eating or for a mask break, or if you will. But there are calls from them and from some other parents about having mask wearing, you know, pretty much uniform across all school districts in New York as they reopen.
Yeah, Nick, we have, and I'll ask Jim or Melissa or Dr. Zucker, but we basically have a mask. We were the first state in the nation to have a mask ordinance. It's a mask if you're within 6 feet of a person. The local school districts, they don't need me to say in New York City when the children should wear a mask, or in Buffalo or in Long Island. That's a local school district can decide on a mask policy specific to that application. And we've left some flexibility for local application. So you don't need a state rule to do something in your school district. The teachers need to feel safe. Otherwise, the teachers are not going back to school. I've said that, from day one. We have all these bureaucratic discussions, well, the district, well, the city, well, the board. No, this is about parents, and this is about teachers. Those are the only decision makers here. If the teachers don't feel safe, they're not going back. If the parents don't believe the student is safe, they're not going back. That's what this has always been about. So teachers should feel free to say, this is what we think we need to go back to a safe school in Buffalo, in Syracuse, in New York City, and it can be different in Buffalo and Syracuse and New York City. But what is the specific state guidance on masks?
So, Governor, the rule is that the districts must establish classrooms that are set up to be socially distanced. So you have to set up tables and chairs and desks and those types of activities on school grounds that are already social distanced. And then you must wear masks. You have to wear masks at a minimum if you cannot socially distance. But the guidance highly recommends that students and teachers and staff wear masks at all times, even during instruction and other activities. This was developed with teachers and parents and others across the state with your advisory council. So you must socially distance your classrooms, create the environment where there's separation, and wear masks. You must, at a minimum, wear masks if you're not socially distancing, but we strongly recommend, as a matter of state policy, that students and faculty and staff wear masks at all times.
Yeah, and Nick, the reason why you have to have some local flexibility, depending on the application, because once you have a statewide rule, then you have no exception. As Jim said, our guidance strongly recommends in all situations. But let's say I'm doing outdoor learning, and the next student isn't within 15 feet during an instruction period. Outdoor learning, and the student is 15 feet away. Do I really have to wear a mask during instruction in an outdoor setting? I mean, it wouldn't make any sense, right? So that's why we can strongly recommend have minimum standards, but there are major differences among school districts across the state, and we want to take them into consideration. And again, if the teachers in New York City require that, then do it.
Great. Next question, operator.
Our next question comes from Jay Tokas of the Buffalo News. Your line is open.
Good morning still.
Jay,
I was wondering, yes, I was wondering if you have any indications of what is driving the higher infection or positive test rates in Western New York, particularly Buffalo, the city of Buffalo. Is there? I mean, we have a lot of colleges here. The students are returning, have been returning for a few weeks. Is there any correlation there?
Gareth, I think, has been looking at the data. Dr. Zucker, do you want to say anything at this point from the data, Gareth or Dr. Zucker?
Sure, this is Gareth. We tested 1,024 people yesterday at these rapid sites, as the governor said, and this will allow the contact tracing program to, with these rapid results, you can mobilize immediately. So we are currently doing contact tracing for each of the positives we found yesterday. So we should have that answer very shortly. We were originally tracking a handful of cluster situations in Western New York, including at a food processing plant, at a steel plant. We had two nursing home facilities with a small uptick amongst the staff. and some of the seasonal labor, of course, and then, as you mentioned, some of the university students. So what we will do is we will quickly track these contacts, the contact of these positives and these positive cases to figure out exactly where they're coming from. And part of the reason the governor mobilized this SWAT team was because of the fear of community spread. So that this is separate from just clusters, that it's spreading from clusters into the actual community. And that is why we set up these testing sites where we did. And so that is what we're using them for, to identify cases and to quickly monitor and control them.
But, Jay, so the short answer is, on the data, besides the cluster sites that we've looked at before, we don't have anything specific. The contact tracing, though, this whole exercise is about the contact tracing, right? The contact tracing is how you actually slow the spread, and then you may find patterns of where it's coming from. But we don't have the contact tracing data yet. On the speculation, look, I don't think Buffalo has any more colleges than other parts of the state. Some parts of the state may actually have SUNY facilities that have a higher percentage of students in that community. So I don't know that we know that it's anything other than just general compliance so far, just the general compliance rate. But if the contact tracing shows something, that's what it's all about. To the extent we can find a cluster or a cause, we're on it. Some have speculated that it's people at the Buffalo News from the newsroom, but I don't have any reason to believe that so far, Jay. I think it may be Bob McCarthy, but I'm not sure about that. I shouldn't mention that. Just kidding. Operator, next question.
Our next question comes from Dan Clark of PBS. Your line is open.
Hi, Governor. Happy Sunday.
Happy Sunday.
Happy Sunday. Just talking about the college parties in relation to SUNY Oneonta. You and I both live in the city of Albany, and SUNY Albany was named the #1 party school a couple of times in the last decade. Is there anything that the state can do to prevent these parties and large gatherings off campus before they happen, so that you can prevent the cases from being contracted in the first, rather than responding after the fact?
Well, we'll do anything that SUNY says we could do to help, but I think it's really up to the SUNY administration of those particular colleges to enforce the rules. And I'm confident that Mr. Malatras is doing that. Jim, do you have any comment on that?
We've been working with local law enforcement, working with our police department. We expect that any parties be broken up and those students be ticketed. Any students that are ticketed will be moved for a judicial proceeding and moved to be suspended immediately, because this is serious again. So we are moving very aggressively when those cases exist at parties on or off campus.
One last question.
Our next question comes from Jeff Kolikowski of News Channel Line. Your line is open.
Hi, Governor. How are you this Sunday?
Hey, Jeff. How are we doing?
As good as it can be. So you may have seen protests or rallies, let's call them rallies, at outside the state-approved casinos on Thursday, like Del Lago, Vernon Downs. Do you have any guidance as to what the future may look like for these state-approved casinos? Is there any chance they're going to be able to open anytime soon under some sort of, reduced capacity or something like you've done with gyms?
I understand their point. I understand the economic reality. I understand the feeling that you see other things, other places opening up, but you still can't get back to work, whether it's a movie theater, some parts of the state, shopping malls, casinos, etc. Obviously, the common denominator is these tend to be congregate facilities, central air filtration systems, and it's hard to enforce social distancing in them. I get it, and we're trying to find a balance. I understand people's anger and frustration. I do. And I feel it also. right? I want people to be back at work. I want people to have the dignity of work and the security of work. I'd like to see the economy come back as fast as possible from the state's point of view. But on the other hand, same thing. It's the same thing we've been talking about all day. You know, if the colleges don't enforce the rules, then they wind up closing down. We don't enforce the rules, or we open up too fast, then we have to backtrack, like France and Spain and Germany and Florida and Texas and all these states all around us. On casinos, we will have an announcement next week, and we'll be able to hopefully. It's going to be positive news. Okay, thank you all very much for taking the time. Thank you, people who are on the phone, and thank you, members of the press. Go enjoy the Sunday. It's a beautiful one here. Weather forecasters had us worried, but so far so good. Thanks all very much. Thank you.
Thank you.
Ladies and gentlemen, this concludes today's conference call. Thank you for participating. You may now disconnect.